Hello, dear viewers. Welcome to e-learning. Subscribe to our SCOP Academic YouTube channel and turn on notification. Dear viewers, we have started the Drug Information Services, in which the contents are Introduction, Drug Information Center, Classification of Drug Information Services, Guidelines for setting up a DIC, its location, its functions, Drug Information Bulletin, and role of computers in pharmacy. In this particular video, we will discuss the guidelines for setting up a DIC, introduction, DIC, and the classification of drug information sources. Already we had covered in our previous video. So, guidelines for setting up a DIC. As DIC is a valuable source of information pertaining to drugs, it is therefore the duty of hospital pharmacists to make the necessary arrangements for its proper functioning and enable it to function as a vibrant center. As the other health professionals are already overburdened, and hence the profession of pharmacy and its professionals can well accept the challenge of setting up a drug information center. The following guidelines that will be useful for setting up a DIC. The professional and technical competence in the evaluation of critical selection and utilization of the drug literature will be a prerequisite. Drug information with a minimum volume of pertinent supporting documentation so as to permit independent, informed conclusions and decisions should be made available. The knowledge of institutional and library facilities, literature utilization, and library services will help in taking full advantage of all the resources available for this purpose. Written and verbal communications skills which enable to contribute effectively to intra and inter-institutional dialogue regarding pharmacotherapeutic information that are very important. The capacity to contribute in education to all health professionals will be the duty of DIC in charge. The DIC is involved directly and indirectly in patient care and act as a monitor of its characteristics. The DIC in charge should be familiar with electronic, basic computer literacy, data processing, methodology to the extent necessary for him to make use of its services to other health professionals. The DIC should provide professional services to support the pharmacy and therapeutic committee. Although regional drug information services or networks are not very common, some of the goals of the regional network could be the development of a reproducible, standardized reporting system for auditing drug therapy, supplying of information to all the hospitals. This facility should be the responsibility of government and have the following objectives: an analysis of drug information and drug therapy for critical ailments like heart disease, cancer, stroke, and related diseases, and provision of supply of this information to the patient. A drug information abstract services should be made available to the physician in the region regarding new development of drug therapy in different diseases. An analysis and evaluation of the regional utilization of drugs in the institutions served by the network and dissemination of this information to the respective medical staff. For further reading, the viewers can go through the references that are given on this particular slide. So in this particular video, we had covered the guidelines for setting up a DIC. For remaining topics, DIC, its location, function, drug information bulletin, and role of computers in pharmacy, you have to wait until our next video. So, dear viewers, thank you for watching. Take care and happy e learning.